Hello friends, how are you? I hope you are all fine and doing well. Today in this video we are going to discuss some more MCQs and also will try to solve them. So welcome to this video. Today our first MCQ is there is a drug X whose therapeutic effects are seen at a dose of 50 mg, while at its dose of 250 mg, significant adverse effects are observed. What is the therapeutic index of this hypothetical drug? Actually, we know the formula of therapeutic index, which is equal to toxic dose divided by therapeutic dose. So in this case the toxic dose is 250 mg while the therapeutic dose is 50 mg. So by dividing the toxic dose by effective dose we will get, so let's use the calculator. Here the toxic dose is 250. Now we will divide it by the therapeutic dose, which is 50. So the answer comes as 5. So the therapeutic index of this hypothetical drug is 5. C is the correct option here. Now moving on to the next MCQ of this video. If 1 is the maximum activity and 0 the minimum, then the intrinsic activity of an inverse agonist will be, actually the inverse agonist is a drug that binds to the same receptor as the agonist but induces a pharmacological response that is opposite to that of the agonist. So the options are there: more than 1, 1, more than 0 but less than 1, 0, and less than 0. So the correct option in this is E, less than 0. Inverse agonist activity is less than 0. It is actually less than the minimum. So now moving on to the third MCQ. For candesartan, which is angiotensin receptor blocker and used in hypertension and other diseases, the daily therapeutic dose ranges from 2 to 16 mg, 4 to 32 mg, 75 to 300 mg, 150 to 600 mg, and 300 to 600 mg. So the correct option in this is 4 to 32 mg. So the daily therapeutic dose for candesartan ranges from 4 to 32 mg. Now the fourth MCQ. For irbesartan, which is again an ARB or angiotensin receptor blocker, the daily therapeutic dose ranges from, again options are there, and the correct option in this is C. 75 to 300 mg is the daily therapeutic dose range for irbesartan, which is actually more than the candesartan. Now moving on to the fifth MCQ. We have two drugs, X and Y. Both these drugs produces a certain therapeutic effect, but the drug Y produces the same effect in a larger dose. Which of the following is or are correct statement or statements in the light of the above? Drug X is more efficacious than drug Y. Drug Y is more efficacious than drug X. Drug X is more potent than drug Y. Both the drugs have the same efficacy. And last option is option C and D, both are correct. So actually we know from the above MCQ question that these drugs will produce the same therapeutic effect, but the drug Y produce it in larger dose. So it means the drug X is more potent than drug Y. To produce the same effect, less amount of drug X is needed. So drug X is more potent than drug Y. So one option is this. This is also correct option. And since both will produce the same effect but in different doses, so both have also the same efficacy. So both the drugs have the same efficacy. This option is also correct. So actually the correct option in this is both C and D are correct. Now moving on to the 6th MCQ. All of the following statements are correct about sympathetic nervous system except. So options are there. Its origin is spinal cord only. It has short preganglionic and long postganglionic fibers. Its postganglionic fibers are extensively branched. D option is its ganglia is located near the spinal cord. And E option, it originates from both the brain and spinal cord. So we have to identify the statement about the sympathetic nervous system that is not correct. So actually we know that sympathetic nervous system is also known as thoracolumbar division, and thoracolumbar we know that it is part of the spinal cord only. So the first option is correct, that its origin is spinal cord only, since it is also known as thoracolumbar division and that has origin in the spinal cord area. So option A is correct. It has short preganglionic and long postganglionic fibers. This is also true. Its postganglionic fibers are extensively branched. This is also correct about the sympathetic nervous system. Its ganglia is located near the spinal cord. Since its preganglionic fibers are short, so the ganglia is located near the spinal cord. So option D is also correct. And the option E, it originates from both the brain and spinal cord. This is actually not true about the sympathetic nervous system, because it originates only from the spinal cord region and not from the brain. So option number E is the correct answer to this MCQ. Now moving on to the 7th MCQ. All of the following statements are correct about parasympathetic nervous system except. Actually this MCQ and the last one, they are actually pharmacology MCQ and belong to the sympathetic nervous system drugs and parasympathetic nervous system drugs. So again we are asked about the statement that is not correct about the parasympathetic nervous system. Actually the parasympathetic is also known as craniosacral division, meaning that it originates from both the cranium, that is brain, and sacral or spinal cord region. So it has its origin from both the brain and spinal cord region, and the option A says that its origin is spinal cord only. So we can directly say that option A is not correct about the parasympathetic nervous system. All the rest of the statements are correct. They have long preganglionic and short postganglionic fibers. Its postganglionic fibers are minimally branched. This is true for parasympathetic division. Its ganglia is located near the innervating organ. This is also true, and it originates from both the brain and spinal cord. As we have discussed that parasympathetic is also known as craniosacral division. So option E is also true for or correct for parasympathetic nervous system. So the correct option for this MCQ is A. Now moving on to the 8th MCQ. Upon sympathetic stimulation of adrenal medulla, the following is or are released. This is actually a physiology question. So upon the sympathetic stimulation of adrenal medulla, which is released? Epinephrine only, norepinephrine only, 80% epinephrine, 20% norepinephrine. D option is 20% epinephrine, 80% norepinephrine, or epinephrine and norepinephrine are released in an equal ratio, that is 50-50. Now the correct option in this is C, because upon sympathetic stimulation of adrenal medulla, what is released is 80% epinephrine and 20% norepinephrine. So the correct option is C. Now moving on to the 9th MCQ of this video. Autonomic nervous system is also known as visceral nervous system, vegetative nervous system, involuntary nervous system. Option D is both A and C, while option E is all of the above. Actually, autonomic nervous system is also known as visceral, vegetative or involuntary nervous system. So option E is correct. All of the above are synonyms for autonomic nervous system. Now moving on to the last MCQ of this video. Acetylcholine is the neurotransmitter at the following site or sites: sympathetic ganglia, parasympathetic ganglia, adrenal medulla, neuromuscular junction, and all of the above. Actually, acetylcholine is the neurotransmitter at all these sites: sympathetic ganglia, parasympathetic ganglia, adrenal medulla, and neuromuscular junction. So option E is the correct answer. Friends, this was all for now. Thanks for watching, and if you have any question or if you want me to explain some point in this video or in some other video, you can notify me in the comment section below and I will get to you, and as much as I can, I will try to solve your question or problem. So thanks for watching, and please subscribe to my channel if you want to get notified for more upcoming such videos, and more videos are coming. So stay tuned, friends. Thank you. Thanks for watching.